morning and thank you for joining us. There's been a setback in the fight against COVID-19 in many parts of the world. Canada and other countries may be moving ahead with reopening plans, but the global picture shows the pandemic is worse than ever. Yesterday, the World Health Organization reported more than 183,000 new cases around the world. That's the highest number of cases recorded in a single day. So many of those cases are coming from two regions. Brazil seeing the biggest surge, reporting more than 34,000 new cases today. The total there, now over 1 million. And the U.S. with more than 32,000 new cases. It's still the worst hit country overall with more than 2 million cases. As Redmond Shannon reports tonight, the news comes as some countries show worrying signs of a second wave.
There was no masking emotions at Madrid airport as Spain finally ended its state of emergency. The tourism destination has reopened its borders to most European Union countries after 3 months that saw almost 30,000 coronavirus deaths. Progress in France on Monday too, with kids returning to school. But as many countries begin to open up, the worldwide picture remains grim, with a new record of daily new cases. And many of the countries that had been doing well are now showing signs of a second wave.
The pandemic is still accelerating. It took more than 3 months for the first 1 million cases to be reported. The last 1 million cases were reported in just 8 days.
Almost half of the new cases on Sunday came from Brazil and the US alone, with heavy death rates across Latin America. This coffin maker in Peru is barely able to keep up with the demand. Violence broke out in Germany when 700 people in an apartment block were quarantined. The country had been doing a better job than many European nations, but the reproductive number of the virus there is now thought to be above 2 or even close to 3. The R number needs to stay below 1 to keep the spread in check. More than 1,000 workers also tested positive at this German meat processing plant.
Explodierende Zahlen.
The state premier says he won't rule out new lockdown measures. South Korea has been one of the success stories of pandemic management. But officials say a small but significant second wave has arrived much earlier than expected.
South Korea, with other countries, demonstrate that even when you get down to very low incidence, you still have to have a very strong public health surveillance system.
South Korea has managed to avoid full lockdowns by implementing a huge trace and test program and relying on public adherence to physical distancing measures. Redmond Shannon, Global News, London.
In the U.S., where the first wave is still accelerating, some states are reporting more cases among younger people who've been congregating at bars and concerts. And there is more criticism of the president tonight, who joked that the U.S. should slow testing to bring the numbers down. Jennifer Johnson reports.
From coast to coast, new cases of COVID-19 are breaking records. Dramatic spikes in over 24 states. Florida hitting over 100,000 cases, close to 3,200 deaths. The highest infection rates among young adults crowding bars and beaches.
Our cases are shifting in a radical direction younger.
A record for new cases was set Saturday in California. ICU beds becoming scarce in Arizona. In Texas, some counties are making masks mandatory after Austin and San Antonio became 2 of the 5 hotspots in the country. Doctors angry after U.S. President Donald Trump suggested the numbers would go down if testing was stopped.
Potential 200,000 deaths by October. It is the number. It has overtaken everything, including homicide and suicide, as the #1 cause of death in the last 3 months. So this is no joking matter.
White House officials say the president was joking, but admit they are preparing for another deadly wave.
We are filling the stockpile in anticipation of a possible problem in the fall.
New York, once the country's epicenter, has better news, entering phase 2 of its economic reopening.
Hundreds of thousands of people will be going back to work.
Experts say people need to keep practicing prevention, frequent hand washing, physically distancing, and avoiding large crowds. But the country's lockdown has taken its toll.
Longer that you sit with that stress, that is when we start seeing people come in with, debilitating panic attacks.
Researchers suggest getting outside, but keep your distance. The new normal for a country desperate to go back to the way things used to be. Jennifer Johnson, Global News, Washington.
Here at home, there's some good news to tell you about on the COVID-19 front. Overall, there were just 284 new cases reported in the past 24 hours. The majority of cases are in Ontario, which reported 161 positive test results today. In that province, there have been fewer than 200 new cases in 8 of the 9 past days. And in Quebec, there were 69 new cases, but no new deaths for the first time since March 1st. As more long-term care homes are declared virus-free, they're taking in new residents to fill the hundreds of beds left vacant by those who have died from COVID-19. But filling those empty beds is opening up new concerns. Ross Lord explains.
After losing 17 residents to COVID-19, the Mark Haven nursing home in Markham, Ontario, has declared the outbreak over. Management says it's refilling empty beds. Some families oppose the move.
I think it's too soon, and I don't know what the plan is.
Cameron Robson's mother, Eileen, lives at Mark Haven. He fears incoming residents will bring infection with them or detract from the care of others.
So it's going to take a lot of time, and without increased staff, something is going to be sacrificed. And my fear is it's the residents' care. It's going to be my mom's care.
Mark Haven says new residents will be forced to isolate for 14 days, the same rules for residents being readmitted after hospital stays. Management says it's very confident in screening procedures, noting the Ontario government is providing extra funding to allow for increased staffing. But at a devastating time for many long-term care homes, balancing residents' numbers with staffing levels is a big challenge.
What's keeping us up at night right now is we have fewer staff in long-term care right now. We're not sure that those who left and are at home right now are going to be willing to come back. The stigma is so great. This is critical.
Labor unions say it's understandable staff are reluctant to rejoin the front line of the war against the virus.
We've had workers who have infected their spouses and their spouses died, and they have to live with that from working in these nursing homes. So some of them are saying this just is not worth it anymore.
Some efforts are paying off. Quebec, which leads Canada with more than 5,000 COVID-19 deaths, has been flooded with applications after offering a generous wage package to orderlies. Healthcare advocates say paying others more across the country would improve the odds of entering the next phase successfully. Ross Lord, Global News, Windsor, Nova Scotia.
The new series that goes inside the COVID-19 pandemic, from the front lines to the everyday heroes helping us cope with the unprecedented change. Coronavirus, the new reality. A Global News special, Sundays at 7 on Global.